Are you struggling to give good feedback to your colleagues in medicine? Well, don't worry, you're probably not the only one. In this video, I'm going to give you my 6 top tips for giving better feedback. Straight after I say, hi, I'm Anthony, the career doctor, and I make videos on YouTube to help you manage your career in medicine. So if you like a video, leave a like or a comment, and if you're back here for the second time, then why not subscribe and turn on notifications. So today we're talking about giving good feedback in medicine. Feedback is a real key skill in my opinion, and it makes a difference between having a positive culture in medicine and a not so good one. For more thoughts on how being better at giving feedback and being a better people manager or teacher, check out this video above. But I promised you 6 tips on feedback, and I'm going to give you them right now, starting with number 1. Psychological safety. Wow, that's a big word, isn't it? What is psychological safety? Well, we achieve psychological safety, whether that be in a supervision relationship or within a broader team, when we establish an environment of trust so that everyone can learn without the fear of being criticized or ostracized, including learning from mistakes. It's well known that psychological safety is critical to learning. If we feel safe in a supervisory relationship or in a team, we will learn. If we don't feel psychologically safe, we feel anxious, we feel under threat, and that changes our brain remarkably so that it's not in the right state of mind to do learning. We basically just want to flee the situation. So as an example, if you are a medical student and you've just joined a new medical team and you're on the ward round for the first day, and the consultant is there along with the advanced trainee, the basic trainee, the resident, the intern, the nursing staff, the allied health, and they turn to you out of the blue and ask you for 6 causes of right heart failure, that's not psychological safety. However, let's say that I, as a consultant, have been working with you now for a few weeks, and you've identified one of the things that you want to be better at is understanding the causes and the management of heart failure. So you then present a case of a patient that I have under my care to me in my rooms, and we discuss the case and we discuss the possible causes of the heart failure. That is a psychologically safe environment. A key thing about psychological safety, in my opinion, is the fact that it takes time to develop. When you're new to a team or when you've got a new team member, they're not going to immediately trust that the environment is safe. You're going to have to work towards it. My tip here is to keep at it with other people in your team. Anyone where you've been appointed into the teacher role and they're the learner, or you're the supervisor or the manager and they're the trainee. Keep trying to establish an environment of psychological safety. Set up quiet, private meetings, and keep asking your trainee or learner, is this something that you can do to help them with their job or with their learning? It will take at least, on average, 3 times before that person is going to take you seriously and open up. So keep asking if there's anything you can do to help. Tip number 2, ask permission. How many times have you been given feedback and you weren't ready for it? Or how many times has someone said to you in medicine something that kind of sounded like feedback, but you weren't sure if they were criticizing you or indeed it was a form of feedback? It's very important that we seek permission from our learners and trainees to give them feedback. This taps into the previous tip, which is of establishing a trusting relationship. No one wants to be given feedback, particularly feedback that's maybe not as positive, unsolicited, or very few people. So make sure when you are working with someone and you see a behavior that you want to give some feedback on, that you signpost it and you flag it to that person that you are wanting to give them some feedback. Tip number 3, be non-judgmental and treat this as a learning opportunity. Again, here we're tapping into this issue of establishing a trusting relationship between you, the teacher, and the learner, or you, the supervisor, and the trainee. It's important that we realize that the majority of people that we work with are coming to work with us, meaning well, wanting to do with patients, wanting to improve, wanting to get better, intelligent enough to make changes to their practice or their knowledge. There's this concept that we borrow from the Harvard Center for Medical Simulation, and we acknowledge them, and it's called the basic assumption, and it kind of goes along this line that learners are intelligent, capable, they want to do well, and they are open to feedback. So if we take that positive attitude to the learner, even though we might have seen something that really wasn't the right way to do something, or misdiagnosis or an error or something like that, we realize that that's just because the person hasn't learnt about that particular thing yet. So by taking a positive attitude to giving feedback, when we see a learner or a trainee do something that we wouldn't do exactly that way, we realize that there's a lot of good in that person, and there's a reason why they've done that thing in a certain way. It might be because that's how someone else has taught them, that's how they've practiced that scenario in similar situations, or no one's taken the time to step them through that activity. It's important to be positive because we understand that in giving feedback, we reveal that there may be a number of reasons why a behavior occurred. And just by giving the feedback about what was wrong doesn't necessarily help the person to learn and adjust. Tip number 4, be timely and specific with your feedback, but not detailed. So a key thing that we've known with feedback is that the closer to the activity that we can give the feedback, the better it is for both you as the person giving feedback as well as the learner, because you can remember more clearly what happened and you can relate the feedback. What we also need to do is give specific examples of what you observe to help enable the learner to improve. Often we're just told, that was a good job you did with the patient there, or I really liked your interview process. Try and do a little bit better than that. Perhaps there was an example of a question that the trainee put that was done in a very good way, that if they focused in on using that approach again, could help them with the rest of the interview. So you could say something like, look, I really liked the way you approached taking the background history with Mrs. Jones. How do you think that helped in getting better information? So notice here, we're being specific in our feedback, but I think a trap with specificity is being too detailed. Sometimes we see lots of things that we want to give feedback on, and it's probably more important to focus in on the one key thing that you want to treat as a learning opportunity, rather than cognitively overloading a trainee or a learner with a whole different number of pieces of feedback so they're actually confused at the end of the day. So be specific, but don't be detailed. There's no need to go into several minutes of feedback and cover 20 or 40 points. Probably best is to focus in on the one key point and be as specific as possible about that. Tip number 5, do a course on feedback. So this year I've done a couple of courses, actually 3 now, that relate to feedback. Firstly, I've done a 4-day coaching course where obviously a lot of the focus there has been on how to give feedback and understand frames of reference from the person that you're coaching. Secondly, recently I did a 1-day feedback course with our local simulation centre, which was really focusing on this idea of the basic assumption and uncovering the frames of reference of the learner. And finally, at a recent conference I attended, we did some work on giving feedback to learners who are in a remediation setting. So I think it's important to train up on our key skills in medicine, and as I say, one of the key skills that you will need as a doctor leader is the ability to give good feedback to those you work with. Now, if you don't train and get feedback on your own feedback approach, then you don't know how good you are at it, and you're probably not great at it, and you certainly won't improve your performance. So we like to go to conferences to improve our medical knowledge and our medical skills and capability. Why not focus a little bit on the other skills that we need to be a good doctor, communication being one of them, and giving good feedback being an important part of communication. My final tip, number 6, is role model feedback. What do I mean about role modeling feedback? Well, if the focus of today's video is on how you can give better feedback, then it's also important to think about how you come off, how you look when you're receiving feedback from other people. Do you encourage it? Do you take it well? Do you use it to improve yourself? One of the things we know about good teachers and good leaders in organisations is that they role model the values and the behaviours that they want to see. And it helps others to adopt that behaviour instead of values. So if as a more senior doctor, or even say a trainee when you're maybe working with more junior doctors, if you're setting up an environment where people are actively coming to you and giving you some feedback on your performance, and you're acknowledging that, and you're thanking them for that, and you're using that feedback, then that sets up a really positive culture for your team and the people that work with you. And if people see that you're using feedback to be better, then they're going to be more open to receiving it themselves. So there's my top 6 tips on giving better feedback in medicine. As I say, I think as a profession we could get a lot better at this sort of stuff. There are other industries where they've taken a lot of time and effort to change the culture to improve the process of giving better feedback. The airline industry is the one that's often quoted in medicine, and we often try and borrow some lessons from that particular industry. However, medicine is a little bit different to an aeroplane. A lot of the times our hospitals are very leaky, they're open systems, and airplanes are generally closed systems. So there are probably some other thoughts and innovations that we could bring into bear. So that leads me to the comments for this video. So what did you think about those top 6 tips? Did they resonate with you? Do you have your own personal favorite tip for giving better feedback? I'd be interested to know what works for you in terms of giving good feedback in medicine. Leave a comment below, and if you like this video, leave a like, and if you're here for the second time, turn on subscriptions and turn on notifications, and I will see you in the next video. Bye for now.